In March, you told us that you practically broke your arm patting yourself on the back for not voting in January to just eliminate the ACA. You told us that that was because you didn't think that healthcare could be solved in a couple of months. It's too complicated. It took you 3 weeks. 3 weeks to go from it's too complicated and it can't be done quickly to I've got a huge pile of excrement here that is a horrible mess of a bill that 17% of the population wanted, that the CBO said was going to kick 24 million people off of health insurance. 3 weeks, Congressman. 3 weeks, Tommy boy. That's all it took for you to go from I'm not going to do it that quickly to I've got a yes vote in my pocket and I'm going to use it.
Well, that was New Jersey Republican Congressman Tom MacArthur, one of the architects of the GOP compromise and the pre-existing conditions, off camera hearing it from that constituents at a town hall last Wednesday in the Garden State. Now, MacArthur, who you saw there on the screen, is far from alone. The stories and the damaging video continue to roll in from angry town halls all across this country. Nor is MacArthur alone when it comes to Republicans from our region facing the angry electorate. And now a pair of stories about another New Jersey Republican are making national headlines, and again, for them at least, for all the wrong reasons. Let's bring Andrew back with more.
Well, Rich, this is the story of what some are calling New Jersey Congressman Rodney Frelinghuysen's broken promise to people with pre-existing conditions. But really, it's the story of a cancer survivor trying to get the congressman to protect her life, like he voted to protect the Republican health care plan.
This other letter is from another of your constituents named Adina, and she is successfully battling stage 4 breast cancer. She's the mother of 2 young kids, and she's the primary earner for the family.
See the concern on Congressman Rodney Frelinghuysen's face? That's nothing compared to the years of worry facing the woman who wrote that letter, Adina Renfro Michelle.
I have stage 4 breast cancer, metastatic breast cancer, if you want to say it that way. So I had a mastectomy and I had chemotherapy.
Cancer. It is a single word that changes everything. The plans of a lifetime interrupted, and not just for Adina.
Explaining that, you know, that you could die to a 4-year-old is I hope no one ever has to do that, you know, but I know that there are a lot of people that do.
Adina has health insurance through work, and the cost is protected by the Affordable Care Act. So even with the struggles of coping with stage 4 breast cancer, her family is surviving financially. Thanks to insurance and the ACA, even her $11,000 a month prescription, the one she credits for keeping her cancer in remission, is mostly paid for.
With good health insurance, I'm okay. We spend quite a bit of money on doctor's visits and co-pays and things like that. But again, I'm very lucky.
But in dealing with her cancer, Adina has heard the horror stories of other cancer victims. Bankruptcies, selling homes and property, skipping treatments, and more.
There was one woman who wasn't able to get her reconstruction because it would have costed her so much. And I think that's a huge part of this, of feeling like you're going back to normal.
Her struggle and all the others she's heard prompted Adina to get more involved. So on the anniversary of her diagnosis, Adina wrote a letter to her congressman, Republican Rodney Frelinghuysen, who declared himself a no vote before the House scuttled its first vote on health care in March.
My husband and I delivered a handwritten letter to Representative Frelinghuysen's office that asked him to protect people with pre-existing conditions and asked him to continue to protect women's health care in particular, and told my story.
Adina never heard back from the congressman. A few weeks later in April, a Democratic-leaning group from the district met with Frelinghuysen in his D.C. office and shared her letter.
Her cancer is in remission. It's in remission because of some very expensive drugs that she's taking. And she's deeply concerned about any removal of pre-existing conditions as a requirement.
I support looking after pre-existing conditions.
But then, May 4th, the House voted to pass the AHCA. Frelinghuysen, despite his earlier pledge, voted yes.
I was so heartbroken and infuriated at the same time. And this has all been personal for me, but that was particularly personal for me because he was holding my letter in his hand. He had just heard my story and said, yes, I will protect you. And a month later, didn't. And he kept reiterating that bill protected people with pre-existing conditions, and it doesn't. Insurance companies have to give you insurance, but they could charge whatever they want. That's not a protection.
Adina has yet to hear from Congressman Frelinghuysen about his vote or her letter or anything. It is not for lack of trying. Of course, Adina wants to know her health care will be protected, that her life will be protected. But short of that, her request of her congressman seems like an easy one.
If you don't speak to your constituents, even those who disagree with you, you're not in touch. You're not in touch with us. And you have to speak to all of us, people that agree with you and people that don't agree with you.
And if Adina's story was not enough, today Congressman Frelinghuysen is caught in another seemingly tone-deaf voter interaction problem. Back in March, Congressman Frelinghuysen sent out a note to his contributors, noting that Democratic-leaning activists were targeting him for defeat next year. But in one letter, the congressman handwrote a note to one donor who happens to be on the board of a local bank. At the bottom, Frelinghuysen wrote, quote, "One of the ringleaders works in your bank." That woman says she was forced to write a statement to her bank's CEO explaining her actions, and then she received so much pressure she later resigned from the bank. Frelinghuysen, by the way, is the chair of the House Appropriations Committee, which steers or can steer millions of dollars every year to community banks, just like the one where Frelinghuysen's so-called ringleader works, or rather, worked. Rich?
Amazing. I'm curious, is she confident that the Senate's going to fix this? That, we've heard words from Republicans like Susan Collins, et cetera, that they're going to basically start from scratch? Or is she petrified that if it made it through the House, what'll come out of the Senate?
We didn't really talk about its prospects in the Senate. This was more a focus on what is as opposed to what might be. So she's taking for granted that whatever is done in the Senate will somehow be based on what's in the House. I know she's hoping for dramatic changes and for those.
She feels betrayed.
She does. She does, because it was her story. She wasn't directly involved in the whole thing. This didn't become a story until after Frelinghuysen changed his vote or voted in favor of the AHCA. But she says how disappointing it was that it was her note that got him to promise protections that he therefore didn't deliver. On some level, she feels like he didn't deliver for her.
And you see that also with MacArthur and so many other congressmen right now who flipped their vote as well. Andrew, thank you. So we go to the front lines in the healthcare debate, and we are hearing from the patients and constituents as well as the doctors and the hospitals. Palpable fear is out there and frustration, as you've seen in Andrew's piece and these scenes across this country, in town halls in red and blue states, cities and suburbs, as well as even in farm country. Republicans with the courage to face the music, at least, are finding that the empty rhetoric that played just a few days ago on the steps of Capitol Hill are not playing in Peoria. I bet now they're wondering where their beaming, bragging boss is standing.
Premiums will be coming down. Yes, deductibles will be coming down. But very importantly, it's a great plan. And ultimately, that's what it's all about.
That's what it's all about. Well, what a difference a few weeks makes. Republican senators told their younger siblings in the House that the bill is DOA. Their president suddenly mute on the subject. Wouldn't it be nice if he actually answered some of the questions, like constituents, for example, that Andrew interviewed can pose to them about the future of health care? For those folks, it's life and death. I seem to remember a certain someone who blasted his then opponent for her lack of availability to the press.
She is so protected. They are so protecting her. She hasn't had a news conference in like 250 days.
I think she's in the witness protection program.
Well, she's being protected by the government, certainly.
Well, he doesn't need to be protected by anybody. How about getting in front of a town hall yourself, Mr. President, or let alone reporters that could ask you about what you stand for, since you seem to change your position by the day? Like so much else that was Campaign Trump, a character that promised so much and has delivered so little. Only once to this point in his presidency has this man held a press conference since he became president. MIA, as he leaves chaos and uncertainty in his wake. As we did last night and all week, we will introduce you to real Americans, many who trusted and voted for the man who told us how great it was going to be, only to learn, like with so many other things, that this too has been a con.
Everybody's got to be covered. This is an un-Republican thing for me to say, because a lot of times they say, no, the lower 25%, they can't afford private. But
universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they're taken care of now.
The uninsured person is going to be taken care of.
They're going to be taken care of.
It was a con, of course. But as we know, every con man, it seems, needs friends. You've already met a couple congressmen who fall into that bucket, but you can also put their governor there as well. New Jersey Governor Chris Christie, who's been humiliated and passed over more times by the Trump administration than the last kid picked in dodgeball, has tried to salvage a shred of dignity and legacy by making treatment for opioids abuse his final policy issue before leaving Trenton. Standing with the president recently, he promised with his buddy in the White House they'd make this a national priority. After all, Chris Christie was, if nothing else, a guy who tells it like it is.
When I stand up on a stage like this in front of all of you, there is one thing you will know for sure. I mean what I say, and I say what I mean, and that's what America needs right now.
Man, have times changed. After the disastrous Trump Care rollout last week that would have cut funding here for opioid abuse, we now read the fine print and learn that about $900 billion will be gutted out of Medicaid, and it essentially cripples states like New Jersey's ability to fight that epidemic. Mr. Straight Shooter, not exactly a profile in courage.
We also saw a proposal last week that was cleared by the Office of Management and Budget that would cut funding for the Office of National Drug Control by 95%. Wouldn't that cripple your work on the commission?
Yeah, I just don't believe it's going to happen.
So have you expressed that to the president?
I just don't believe it's going to happen, George.
But it's their proposal.
I have a good reason to believe it's not going to happen.
You've been assured it's not going to happen?
I have good reason to believe it's not going to happen, George.
You know what? Like those two prior congressmen, the governor and the president deserve each other, but I think we as a nation, we deserve better. All right, coming up next. After HUD Secretary Ben Carson's controversial comments about people who live in public housing, Dominic, he visited a project in the Bronx to see for himself what's going on and what residents there are thinking.